Hello, everyone, dear colleagues. My name is Anastasia, and I'm practicing as optometrist for 2 years. And today, we, me and also Dr. Teresa, are going to introduce you one of the popular eye condition for the last time. It's about dry eye disease. And on the screen, you can see our today's lecture plan. It covered the definition and classification as the first point. I'm going to present you the main signs, symptoms, and what you should take in focus as optometrist and what you need to underline, what namely your patient are telling you. And the next and the biggest part will be about diagnostic tools. And in the end, I'm going to present you some clinical cases of dry eye disease in contact lens users. And Dr. Teresa will continue about the dry eye disease from the medical point of view. And dry eye is a multifactorial disease of the tears and ocular surface that results in symptoms of discomfort, visual disturbance, and tear film instability with potential damage to the ocular surface. It's accompanied by increased osmolarity of the tear film and inflammation of the ocular surface. And definition of the dry eye disease is showing us that changes mostly are detected in the tear film as its instability. So the tear film covers the cornea and exposed conjunctiva, and it composed of 3 layers. As you see on the right on the picture, the first are mucin layer that sits on the epithelial surface, mainly composed of high molecular weight glycoproteins called mucins. So middle and the thickest part is aqueous layer, consists of water, electrolytes, proteins, cytokines, vitamins, immunoglobulins, and peptide growth factor. And the lipid layer is formed with non-polar lipids like cholesterol ester, triglycerides, and free fatty acids that plays a role in preventing tear evaporation. And the tear film is a thin fluid layer converting the ocular surface. It's responsible for ocular surface comfort, mechanical, environmental, and immune protection, epithelial health, and it also forms smooth refractive surface for vision as the first surface for light to pass into the eye. And from the tear film definition is the one word what help us to catch one of the most common patients' complaint, and it will be the ocular surface comfort. So imagine if your patient is telling you about feeling constant discomfort, maybe it's a sign of unstable tear film, but not about the scratched lenses of the glasses. And what I'm going to tell you, colleagues, that anatomy of the eye help us to listen our patient carefully, but anatomy of the human body will help us to think about diagnosis. And the next slide show you the pathogenesis of this disease and disturbance of the balance of the tear film may be among the main factors in the development of the dry eye disease. So, as you can see from this picture, that desiccation of the ocular surface changes firstly in tear composition, and osmolarity lead to the activated production of inflammatory mediators, like the most famous interleukins, what you can see on this part of the diagram. It will be interleukin beta, interleukin gamma, interferon gamma, and tumor necrosis factor. And the activation of inflammatory neuromediators trigger the dissolution of cell junction, death of the epithelial cells, and the stabilization of the tear film, creating like a big cycle of inflammation. And ocular surface inflammation alters the sensitization of nociceptors and causes sensation of pain and dryness of the eye. And all this lung inflammation and nerve injury can cause a neuropathic pain on the ocular surface. And this is the moment when we meet our incoming patients with complaint about ocular discomfort. Let's talk about how to diagnose dry eye disease from the optometrist side. And the first thing, I think it will be asked about the symptoms. And there are two ways to go about this. It could be questions in the chair. And for the example, you can see on the screen some kind of questions what you could ask to your patient, and also add to your patient card and mark how she or he feel right now. And the second, what you could do is evaluate the patient before the exam with the questionnaire. And in my next slide, I'm going to show you one of them. Is the one of the popular questionnaire. You can also find it in the internet area. It's called the Ocular Surface Disease Index. And this questionnaire including 12 questions, which are subdivided into three big groups. So the first group contain the questions about the ocular symptoms of the dry eye disease. The second about the ocular symptoms when the patients are watching the TV or reading the book. And the third group contains the questions about the ocular symptom induced by environmental factors. And why I have chosen namely this questionnaire, because it has a good psychometric properties, and it was created to assess subjective dry eye symptoms and the effects of the dry eye disease on the vision-related activities. And what you can see on the screen also is the formula, how you can make a scoring of the result. And as you see, the maximum score of points will be 100, and it's also suggested to classify these respondents' answers. And if your patient got 12 points, it will be a normal condition of the eye. If it's between 13 till 22, it will be a mild dry eye. So moderate are when is a maximum of 32, and severe condition is 100 points.